Hi, everyone. As a committed urologist and medical professor with more than 30 years of practical experience in men's health, my name is Dr. Layla. I've dedicated my professional life to helping mature gentlemen maintain their vitality in their daily lives as well as in the bedroom. Imagine this. What if I told you that you can reverse the silent decline that many men experience downstairs with simple behavioral changes that don't require taking any medication? I'm sharing a revelation with you today that has transformed lives in my clinic. Imagine regaining the confidence that gives you a sense of genuine aliveness as we dive in, because that is precisely what is possible. I'll begin by introducing you to a story from my own work. Robert, a 68-year-old patient, entered my office just last week with his shoulders hunched and his eyes averted from mine. After 40 years of marriage, intimacy seemed like a thing of the past. He believed it to be simply old age catching up, as many men do. He left with a plan, though, following a heartfelt conversation and a few minor tweaks. Months later, he emailed me, beaming about how he and his wife were rediscovering each other. When men assume leadership roles, stories like Robert's are not uncommon. Rather, they are the rule. And for that reason, I have a strong interest in this subject. Like their heart, brain, or bones, most men are unaware that their penis ages. Ignoring it damages your self-confidence, sense of value, and the strong relationships that give life meaning. It does more than just make things less functional. Here's the empowering reality, though. The primary cause of penile dysfunction in men over 60 is not years of age, but rather daily neglect that is frequently disregarded. And you can change that narrative with simple, scientifically supported exercises that don't involve drugs. I'll take you through 5 essential tactics designed for men in their prime in this discussion. These are tried and true, doable actions that improve your quality of life and protect your health. Additionally, stay tuned as I'll share a bonus tip that most doctors miss that could protect you from a painful penile condition that affects older men. If you haven't subscribed yet, click the button and ring the bell before we get started. You'll receive age-appropriate, useful health insights that are specific to your stage of life and will help you stay healthy. If this resonates with you, please leave a 1 in the comments. If not, leave a 0 so I can better explain. Your comments help me better serve you by influencing what I share next. Keeping things going down there, even if partnered intimacy isn't on the table at the moment, is the first essential. There's a use it or lose it mentality in the body, and your penis is no different than any other muscle. So many men in their 60s and older have whispered to me in my years of practice, "I guess that's it for me sexually." They are helpless because they have silently given in to the myth that desire dwindles with time. Let me clarify, however, that this is not only false, but it is also a self-fulfilling prophecy that hastens the decline. Regular activity is essential for maintaining tissue integrity, elasticity, and blood flow in your penis. If you skip it for too long, you run the risk of developing penile atrophy from disuse, a condition that is much more common than you might imagine and involves tissues weakening and shrinking. Consider it this way. Picture your favorite vintage vehicle unused for months in the garage. It loses its zip, the tires deflate, and the engine seizes. Your body functions similarly. Blood vessels constrict, oxygen delivery decreases, and cells begin to degrade in the absence of stimulation. However, the upside is exciting. It can be reversed. Whether masturbating alone or with a partner, sexual activity is maintenance rather than enjoyment. It supplies the region with blood that is rich in nutrients, maintaining its suppleness and functionality. It's similar to keeping a tight hamstring, supple over time by stretching it. Now, there are gentle alternatives if traditional methods seem unattainable because of health or comfort concerns. I've advised patients to use medical-grade vacuum erection devices because they safely and strain-free increase circulation. Alternatively, attempt pelvic floor exercises such as Kegels. 10 times a day, squeeze those muscles as though you were holding back pee, hold for 5 seconds, then release. These increase blood flow and can subtly improve performance. The secret? Regardless of age, consistency is key. Your body adjusts and reacts exquisitely. However, this habit affects more than just your physical health, it affects your sense of self. Sexual vitality is entwined with identity for a large number of men. When it diminishes, uncertainty begins to erode confidence. However, you regain that pride by continuing to participate in ways that work for you. It's about respecting who you are now, a man of depth, wisdom, and tenacity, rather than trying to relive your 20s. I have seen 75-year-olds change. In addition to experiencing physical improvements, one man reported feeling closer to his spouse, getting more exercise, and sleeping better after implementing daily gentle stimulation. Strengthened intimacy has a cascading effect, inspiring motivation throughout one's life. To ensure a seamless transition, let's talk about proper hygiene, another fundamental principle that is frequently disregarded until issues occur. It may seem simple, but I can assure you that after treating thousands of patients in my clinic, I have witnessed the unnecessary suffering that results from skipping the proper routine. Due to a lack of education regarding the changing requirements of an aging body, men often arrive with infections, rashes, or worse. Skin thins, immunity weakens, and healing slows as we age. A quick rinse, which worked for you in your 30s, is insufficient now and invites trouble. Smegma, a mixture of dead skin, oils, and bacteria, can accumulate beneath the foreskin of uncircumcised men in particular, leading to balanitis, an itchy, painful, and recurring inflammation. It is concerning to note that inadequate hygiene increases the risk of penile cancer, a condition that is directly linked to high incidence rates in places like Brazil. Studies conducted worldwide by the World Health Organization demonstrate how neglect increases these risks as people age because their tissues become more susceptible. The remedy? Gentle daily maintenance. Use a gentle, fragrance-free soap and warm water. If there is foreskin, carefully pull it back, wash underneath, rinse well, and pat dry because moisture encourages the growth of bacteria in skin folds. Repeat after intimacy or exercise to get rid of perspiration, lubricants, or liquids that throw off the natural equilibrium of your skin. This 60-second ritual prevents unpleasantness, odor, and major problems. This change has a significant emotional impact. Similar to brushing your teeth or styling your hair, patients tell me it gives them a renewed sense of control and cleanliness. Taking care of oneself in a culture that marginalizes older men says, "I'm still in charge." One patient, a 70-year-old retired teacher, described how becoming proficient in this improved his general hygiene practices, which in turn led to better food choices and more social interactions. Little actions adding up to big confidence gains is empowering. Building on that foundation of care, we need to address a hidden danger in the bedroom: having intimate relations before being completely prepared. Many people are surprised by this, but it's a problem I deal with frequently. Eagerness or pressure may cause rushing into penetration with a semi-erect penis, but doing so invites cumulative harm that changes everything. Your penis is a marvel of anatomy, with smooth muscle, blood vessels, and spongy tissue chambers that are made to remain rigid under pressure. Not quite ready? It is vulnerable to micro-tears from bending or friction because it lacks that structural support. Over time, the scar tissue from these small wounds stiffens and contracts, which may result in Peyronie's disease, a painful curvature that can occasionally be so severe as to completely prevent sex. According to research published in the Journal of Sexual Medicine, up to 13% of men over 50 suffer from this, frequently as a result of hidden traumas. I've given advice to heartbroken men who put off getting help because they were embarrassed, only to find out later that they needed surgery. However, prevention is simple. You have patience on your side. Await a full erection, use lubricant to make things easier. Engage in open communication with your partner, and engage in foreplay. Give aids, such as ED medications, time to do their job. This is wisdom, safeguarding your enjoyment in the future, not weakness. One notable example is a 62-year-old widower who hurt himself while rushing into a relationship. He fully recovered and developed healthier relationships after embracing mindful practices following education and therapy. It emphasizes how well-informed decisions maintain both function and joy. Moving on to a contemporary hazard that traps the mind just as much as the body: an excessive dependence on pornography. It's pervasive in our digital age and provides instant solutions for feelings of loneliness or diminished desire, particularly for older men who are grieving or single. However, in my opinion, something that seems innocuous at first can undermine genuine relationships. Excessive viewing alters arousal pathways in the brain, requiring stimuli that get stronger over time. Real-life interactions fail due to this desensitization, leaving people perplexed. I want it, but nothing happens. Dopamine responses to natural intimacy are dulled by porn addiction, which resembles substance dependence, according to Cambridge University studies. It exacerbates the emotional problems of aging, such as retirement blues or health concerns, by fostering feelings of loneliness, shame, and self-doubt. Many patients compassionately confide in me about this struggle, so I'm not passing judgment. I suggest moderation or taking breaks. Re-establish arousal via touch, fantasy, or emotional connections. Instead, write in your journal or talk to friends in the evenings. After cutting back and focusing on hobbies, a 65-year-old client soon reported feeling more sensitive and having stronger relationships with his partners. Regaining true pleasure and balancing the body and mind for satisfying experiences are the goals. Lastly, lifestyle over temporary solutions is the overarching theme that unifies everything. Pills are useful, but nothing compares to holistic practices for long-term health. Your daily decisions affect hormones, blood flow, and mood, all of which are essential for sexual health. Erections are biologically dependent on vascular health. Smoking, binge drinking, or eating poorly can clog arteries and starve tissues. According to data from the American Heart Association, ED frequently indicates heart problems, your body's first warning sign. Reversals, however, happen quickly. Give up smoking and your circulation will return in a few weeks. Balance testosterone and replace alcohol with water. According to research on the effects of a Mediterranean diet on older men's function, walking for 30 minutes every day, and eating a diet high in greens, nuts, and omega-rich fish nourish vessels. Mentally, getting 7 to 9 hours of sleep and managing stress through meditation help to replenish libido. I have witnessed changes. By changing his routine, morning walks, veggie-packed meals, and quitting medications, a 70-year-old diabetic gained intimacy and vitality. It's evidence that your body reacts positively to attention. And that extra piece of advice? Commando sleep, without the tight panties. Constrictive clothing compresses, increasing the risk of irritation or scarring toward Peyronie's, but nightly erections, 3 to 5 per sleep cycle, oxygenate tissues. Sleeping loose or naked enables unrestricted healing. Patients report improved function and comfort despite the switch's simplicity. One 67-year-old claimed it improved his days by relieving morning aches. Finally, gentlemen, it may feel uncomfortable to talk about this, but your body's story doesn't stop at age 60. It continues to change. These actions, remaining active, maintaining personal hygiene, practicing mindful intimacy, setting boundaries for porn, improving one's lifestyle, and sleeping freely, are not just suggestions, they are declarations of value. I've helped innumerable men rediscover their dignity by accepting the present rather than pursuing youth. Be aware that change begins today. If you have been struggling in silence, you are deserving of funding. We appreciate your participation. It's never too late to work together to promote men's health.